Hello everybody, my name is James. In this video, we will discuss renal colic, a sudden and a severe pain caused by a blockage in the urinary system, typically due to the passing of a kidney stone, for example. We will also take a look at the causes, symptoms, diagnosis, as well as the treatment. So hit the subscribe button, stay tuned, and let's get started. Alright, so the question is, where do stones often get stuck in the urinary tract? Renal stones tend to get trapped in specific locations within the ureters, such as the ureteropelvic, right here, the ureterovesical, where the ureters enters the bladder, and of course, where the ureter crosses the iliac artery. Now, these areas are anatomically narrow, leading to increased likelihood of obstruction by larger stones or debris, thus causing pain and potential complications if not addressed properly. The treatment approach for renal stones is greatly influenced by factors such as the location as well as the size of the stone, as these variables can determine whether interventions like a shockwave lithotripsy, ureteroscopy, or percutaneous nephrolithotomy are best suited for effectively managing the condition. So as you can see, I have made a medical mnemonic to help you memorize. This U is uretero, so we have ureterovesical, we have ureteroiliac, and of course we have ureteropelvic. This is to help you orient and memorize the areas that stones often get stuck. So renal colic typically manifests as a very intense and sudden colicky pain in the abdomen that can escalate progressively and extend to the loin or groin or even to the genital. The individual may also experience tenderness in the costovertebral angle along with symptoms like nausea, vomiting, or even a visible blood in the urine. In some cases, there may be associated signs of UTI, including urosepsis, for example, fever. So, prompt medical attention is crucial when these symptoms are present to determine the underlying cause and provide appropriate treatment. Mechanism of the pain. So, when a ureter becomes obstructed, as in this case by the stone, then the resulting increase in the hydrostatic pressure inside the ureter leads to the dilation of the ureter. In response, ureteric contractions and peristalsis attempt to overcome the obstruction. This causes further pressure that extends all the way back into the kidneys. This can result in distension of the fibrous renal capsule, and this contributes to the pain experienced. The presence of pain receptors in the upper ureteric and renal pelvic calyceal submucosa further amplifies the discomfort felt in this scenario. Diagnosis. Now, this may include assessment for hematuria, leukocyte esterase, and nitrites on dipstick, as well as performing urinalysis with microscopy, culture, and sensitivity. Further evaluation with a complete blood count, ESR, C-reactive protein, serum creatinine, GFR, urea, and electrolytes are also very important. Blood culture may be necessary if urosepsis is suspected. A metabolic panel including calcium, phosphate, uric acid levels, and parathyroid hormone levels are also very important to consider in the diagnostic workup. CTKUB, that is CT of the kidneys, the ureters, and the bladder, is usually considered or regarded as the preferred imaging modality for detecting renal stones due to its high accuracy and ability to detect smaller stones. However, ultrasounds can also be very useful, especially in cases where CT is contraindicated. It is important to note that a scalp film, that is abdominal X-ray, may not detect a uric acid stones. That is, its sensitivity is only high for radio-opaque stones. So when do you have to refer to the urologist? Certainly, a stone size of greater than 5 millimeter can be referred to the urologist. The ureteric diameter can range all the way to about 4.9 millimeter. Hence, it can be concluded that any stone that is greater than 5 millimeter would have difficulties being passed spontaneously into the urine. Hence, such stones can be better managed by the urologist. A solitary kidney bilateral nephrolithiasis, recurrent UTI, signs of obstruction such as fever or pyonephrosis or urosepsis, and of course, pregnancy as well. In short, fever with signs of obstruction means you should consult the urologist for an emergency. Maybe a stent or a nephrostomy may be indicated in such cases. Management. So renal colic can be effectively managed with analgesics like a non-steroidal anti-inflammatory drugs, potentially also supplemented with opioids as strictly advised by a healthcare professional. Antiemetics such as metoclopramide may also help alleviate symptoms while ensuring adequate hydration becomes crucial in case of a persistent vomiting. Antibiotics may also be necessary if signs of infections exist. Medical expulsion therapy involving the use of medications like an alpha blocker such as tamsulosin may also be considered for small-sized stones. Nifedipine has also been suggested, but many urologists advocate for an alpha blocker. So in such cases, many of the stones that is less than 5 millimeter may be passed spontaneously into the urine. So alpha blockers relax the smooth muscles of the ureters. Modalities for stone removal. Extracorporeal shockwave lithotripsy. This is better used for upper ureteric or upper kidney pole stones that are less than 2 centimeters. Percutaneous nephrolithotomy, PCNL. This is the modality of choice for stones greater than 2 centimeters, lower pole renal stones, as well as multiple stones. Ureteroscopic procedures. So stone fragmentation using a laser or a pneumatic lithotripsy or a stone retrieval using baskets or graspers may all be used. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel.